How do diabetic athletes use carb ratios for intense activity? Imagine pushing your body to the limit during a race or a tough workout. Now add the challenge of managing blood sugar levels at the same time. That's where understanding carb ratios becomes a game changer. Carb ratios, or carbohydrate to insulin ratios, are a way for people with diabetes to match their insulin doses to the amount of carbohydrates they eat. For athletes, especially during intense exercise, these ratios are part of a bigger plan to keep blood sugar stable and fuel their performance. Carbohydrate counting is about tracking how many grams of carbs are in each meal or snack. A carb ratio tells you how many grams of carbs 1 unit of insulin will cover. For example, if your ratio is 1 unit of insulin for every 15 grams of carbs, then you know how much insulin to take for a certain amount of carbs. These ratios are personalized and often changed based on how active you are, the time of day, and how your body responds. When you exercise intensely or for a long time, your body uses more glucose for energy. Muscles pull glucose from your blood, which can cause your blood sugar to drop if you don't adjust. Without a pancreas to automatically adjust insulin like in people without diabetes, you need to plan ahead. Before working out, check your blood sugar. If it's low, eat some carbs without insulin to bring it up. If it's in a good range, you might still eat some carbs, especially if your workout will last a while or be very intense. Many athletes reduce their pre-exercise insulin dose by 50 to 80% depending on how hard and long they plan to exercise. This helps prevent blood sugar from dropping too low during activity. During exercise, especially if it lasts more than an hour, it's common to consume 30 to 60 grams of carbs each hour. For shorter or very intense sessions, 15 to 30 grams every 30 minutes is typical. The type of carbs matters too. Quick-acting carbs like glucose gels, sports drinks, or fruit are best because they raise blood sugar fast. Some athletes mix glucose and fructose to get energy quickly and avoid stomach issues, but they test this in training first. Checking blood sugar often before, during, and after exercise helps see how your body responds. Over time, patterns emerge that help you fine-tune your carb ratios and insulin doses. Athletes usually practice their nutrition and insulin plans during training. This helps avoid surprises on race day or during competitions. Carb ratios are not set in stone. They may need to change for travel, different sports, or as your fitness level improves. Some athletes use continuous glucose monitors or insulin pumps with exercise modes to get real-time feedback and make quick adjustments. After exercise, muscles need to replenish glycogen stores, which can lower blood sugar for hours. Eating carbs after activity helps restore energy and prevents late lows. A good rule is to eat about 1 gram of carbohydrate per kilogram of body weight soon after finishing, with extra snacks if needed. Be aware that intense exercise increases the risk of low blood sugar, so always have fast-acting carbs nearby. Skipping insulin adjustments or overeating carbs can lead to high blood sugar, which is also harmful. Every athlete's body is different, so working with your healthcare team is essential. They can help you find the right carb ratios and insulin doses for your sport and goals. In short, mastering carb ratios during intense activity is about planning, monitoring, and adjusting. With practice, you can stay safe, keep your blood sugar in check, and perform at your best.